This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. Thanks for joining us. It is the final Monday of the month, and that means our monthly visit with the Monongalia County Health Department. And Dr. Brian Huggins, health officer with the Monongalia County Health Department, is back. Good morning.
Good morning, Kyle. How are you today?
I'm doing well. Thanks for coming in. Good to see you.
Good to see you.
You've got some guests with you.
I do. I brought some public health students with me today.
All right.
Yep.
Well, let's meet them. Melissa Spohn, bachelor student, WVU School of Health. Good morning.
Good morning.
Thanks for coming on the show. We appreciate it.
Yeah, thanks for having me.
Where are you from?
I'm actually from Pennsylvania, about an hour north of Pittsburgh, Indiana, Pennsylvania.
Okay. Been there. Know where it's at. Nice place. We also have Abbott Long, a bachelor student, and a WVU School of Public Health. Good morning. Thanks for coming on.
Good morning. Thanks for having me.
Where are you from?
I'm from Lansing, Michigan, which is about 6.5 hours away.
Okay. What drew you to WVU?
The campus and just everyone was so nice when I came to here to visit, and just fell in love with the school immediately.
All right. So Pennsylvania and Michigan represented.
I know. Right?
Where are you from? I never asked.
I'm
or
from
if I
Wheeling.
did, I forgot. Okay. I don't think I ever asked.
Yeah, that Wheeling feeling.
That's good. Well, Abbott said everyone that she has met is nice, and that would include the folks at the Monongalia County Health Department, and they're helping you with a study. So I'm going to let you explain exactly what's going on.
Yeah, so right now we are running what's called our Community Health Needs Assessment. And the Community Health Needs Assessment is really a critical document that we create about every 3 years or so at the health department. Essentially what that is it basically looks at all the health data in the area and helps us prioritize what are those health needs, what are the big problems, and what do people want in our community, so that we know how to allocate our resources, right? So that we know better what we're going to do with that.
Okay, so needs and wants.
Needs
probably
and
in
wants.
that order.
Not always.
Okay.
Because honestly, and this is, and we'll talk a little bit about, we've got a survey what we're going to ask people to take. There's a big difference between needs and wants in a lot of ways. And I'll give you an example. Healthy food, healthy habits, healthy eating. Everybody said, okay, we've got food deserts, especially in rural America. You've got these areas where there's no grocery store, right? There's only a Dollar General. So they said, let's go put fresh, healthy vegetables and fruit in the Dollar Generals. And they basically, Dollar General got behind it. They did that. And then they were throwing away massive amounts of that food because people don't know how to cook with it. They're used to eating frozen food.
Right,
They're used to eating fast food. They're not used to actually being in the kitchen and cooking that food. So it's not as simple as we know there's a need. It's also, what do people want? What will you actually do if we do that for you?
Interesting. Okay, so what are the students' roles? So Melissa, let's start with you. What are you tasked with on a daily basis to kind of get this thing going?
So at the beginning of all of this, we obviously had to trial run the whole thing, try and shorten it as much as we could, because obviously nobody wants to complete a 5 to 10 minute survey. Let's be real. So that was one of the first things, and we tried to make the questions as helpful and specific as possible that we could get the data that we needed. And now that we're in the midst of putting this survey out, we're just trying to recruit people to take the survey, which once again, not everybody wants to take a survey, but that's kind of what we're doing, is explaining to these people why it's needed and how it's going to benefit them ultimately. Okay,
so you have to boil down the questions so they're not too complicated, and then you have to find volunteers basically to take the survey.
Yeah.
Okay. What type of questions, Abbott, what information are you looking for?
A lot of it is what citizens of the community want to actually have on top of their life right now.
Mm-hmm.
So specific things such as a lot of people want more sidewalks, more exercising areas. And on top of what Dr. Huggins was saying about health wants and needs, it goes hand in hand where they want more sidewalks, but that also plays into the necessity of sidewalks, give more exercise rooms, stuff like that. So it's very much, the questions have a lot of information, even if it's just a simple question. It can give us a lot of more stuff that we can analyze later.
So there's a skill in that itself, crafting a question that gets you more than just a yes or no answer, gives you data.
It's, and it's fascinating that there is a whole education around how to develop surveys, because believe it or not, even just question order, how you ask the questions and the order they're in can actually change how people answer the questions. And you've probably answered a question that says, how do you feel about this? Excellent, good, neutral, dislike, right? That scale. Yes. Depending on if you start with dislike or start with like, people tend to favor whichever one you start with, just because they immediately go, oh yeah, I kind of like that, or oh yeah, you're right, I kind of don't like that. So it's complicated, and we spent a lot of time sitting in a room just talking about what questions to ask, because like they talked about, is time is everything, right? Mm-hmm. So let me ask you, Kyle, how long of a survey do you like to take?
Oh, just a few minutes.
Right, right. So ladies, how long does it usually take our survey?
Typically, from what we've noticed with everybody that has taken it, it takes no longer than 3 minutes. We don't like to give a specific time because obviously there's different factors into that, or if you get distracted or something. But typically 3 or less minutes is about how long it takes to complete this.
So 3 minutes is right in the wheelhouse.
3 minutes is in the wheelhouse, right? And that's what we went for. And yeah, are we going to miss some? Right. But that 3 minutes, that's it's so important.
Mm-hmm. Okay. So how does this data help? Is that one for you, or would you like the ladies to take that?
I think we'll all kind of chime in on that. Yeah. From the health department point of view, we are going to end up forming what's called a community health improvement plan. And the community health improvement plan, we shorten everything down to CHINA and CHIP for these things because it's a big wordful. But the community health improvement plan, the CHIP, is essentially almost like our strategic plan. So when you think about a business, these are the activities. When we look at outreach, when we look at the money, because right now, especially, we've talked about public health funding is it's slim. Mm-hmm. And so we have to be very purposeful with the money that we have. And the last thing we want to do is go out into the community, spend a bunch of money on an outreach project. It turns out the community doesn't want it. It maybe wasn't needed. So that's where this information really helps. And a big part of this too is there's a bunch of national surveys and people be like, oh, I took this national survey, or not. Most people didn't take it. And that's the problem, is the national data, what we find in West Virginia, they do something called weighting, which is they only get a few people that take the study. So then they basically scientifically add more weight to that. And that's how you get your results. And that actually doesn't really represent people very well. And so if you ladies, want to talk about just your studies and what you've learned about the need to get data with health.
So a lot of times, I guess with data too, something that I really noticed with this community health needs assessment is that people do want to be included in the data. They might not have, obviously, the background, but once they understand that we are taking in what they're saying in a meaningful way, a lot of people also I talked to a gentleman who believed that his answers didn't matter. And once I explained to him that, no, we're here to make sure that you don't fall through the cracks, that your data is it's not just even data, it's your life. Mm-hmm. You're important to this community and you deserve to be heard in more than just a way you deserve to speak to people who care. Mm-hmm. But yeah. So
because we did the county fair, yes. Right? Because that was one thing I wanted to, and that's we did the trial run. They mentioned the trial run, and we did that at the county fair because that's really where you're going to get just all walks of life, right?
Sure.
You're going to get everybody in the county. And so tell us a little bit more about like your experience with it too.
Yeah, the county fair was it was fun. It was very kind of eye-opening because obviously this was the first time that we were going out into the community and asking them. And I think it is really, one thing that I noticed is people, once you talk to them, like they were so willing to open up, which was really cool. Like I really loved talking to everybody, and, you know, they'd tell me about like their life or, you know, in regards to the health needs assessment, they'll be like, oh yeah, like throughout my life, like I've seen this and this. And I'm like, yeah, that's like why we'd like you to do the survey. Cause like we see you, like we hear you, and we just want to make these improvements. And I've had many people say to me, you know, they're like, oh yeah, like I've done surveys, but I just feel like it doesn't like matter or it's not listened to. And I'm like, no, like we're looking at everyone's responses, and it like every response helps so much. And I think that was really reassuring for some people because once again, they have went through their life or they've completed surveys and just felt like it didn't matter. But for once they understand that, you know, them answering this is just only going to benefit them.
Mm-hmm. Yeah, people are listening, and there's impact at the end of it. That's what you have to point out.
Absolutely. It's letting people know that we are going to do something with this and going up and talking to people, because how are people going to take the survey? We have a QR code out there. We have a website people can go to. You can find that on our social media. You'll find that on our website. We're also going to be at events, but I actually had the students take iPads and they walked around and going up to people. And I mean, we all know what it's like when somebody comes up to your door and they're trying to sell you a vacuum cleaner or whatever, right? And how we respond to that. But people forget, like these parts. I think all of the students, when I first handed them an iPad and said, okay, going out there into the fair and, you know, ask people, tell us about, like, what do you think about that?
Yeah, at first it was definitely a little nerve-wracking. I was like, oh, are you sure? Like, I was like, we can just sit at the table and, like, see who approaches us. But like I said, once we started talking to people, it honestly was, like, great. I really enjoyed people telling me about their lives, like, their daily, and, you know, there's, like, vendors and stuff that we were talking to, and they were just telling me about what they do, you know, where they're from, and you just get a lot of background. So I think after a few times of it going well with people, which thankfully nobody was blatantly rude, so I appreciated that. But, you know, once I started getting some background on people and they started talking, it made me want to go up to more people and talk to them, because I'm like, okay, that was really interesting. Like, I wonder what the next person, like, what their background, what their experiences are going to be like.
Yeah, and it was really fulfilling. And sometimes I had people who said, like, oh, I already took the survey, but I think that this person, like, they would point to someone who would have really, really good answers and, like, feedback and stuff for the survey. And people were just generally really, really, really receptive once they knew that their voice was being heard. But yeah, and that's honestly, being able to talk to the community has been really my favorite part of my entire degree so far.
Interesting. You know, and the fair is the perfect place too, because it's a relaxed atmosphere. Everyone's happy. For the most part, everybody's with their family. They've got time or they wouldn't be there. You know, you approach somebody at the grocery stores trying to get their groceries. They're stressed out about how much stuff costs, and then they're trying to get their groceries bought so they can get home and make dinner for the family who's coming home. That's one thing, but an atmosphere like the fair seems to be perfect, and I know you're going to be out at some other events as well.
We are. And that's what we've tried. The events that we're at, we're trying to find things that people don't feel rushed, right? Because we've talked about, do we want to be outside the football game? And the answer to that is no, right? People want to get into the football game.
They want to watch
interesting
answers,
right?
After, you know, a couple hours,
right?
Of tailgating.
Yeah, especially not at the end of the football game, especially lately. We were talking about that on the way in, but yeah. So we are going to try to be at the farmers market. We're going to be at the first Friday, like the arts walk. We're also going to have the trunk or treat. So on October 30th at the health department, we are going to have our own trunk or treat. I know they always have one at the Coliseum, and which is a great option. And we'll be talking next month, of course, about Halloween safety. But a lot of people choose to do those trunk or treats. And so, you know, those are going to be great opportunities. The students are also going to try to maybe be at libraries, places like that, because we do want to try to get in areas where we get different kinds of people, right?
Yeah.
And so hopefully it's gonna go well. Yeah.
Let's take a few minutes and find out from the students what, first of all, how they got involved and what the benefit to them is. Let's start with you, Melissa. This is part of an opportunity to get class credit, correct?
Yeah, so basically, Abbott and I are both seniors this year, so we have to do a capstone and then a capstone project, and part of that is getting 75 hours of field experience. So the health department so graciously works with the students of public health and basically takes us in and gives us real life opportunities of public health in the real world. So so we're getting in our hours right now, and that's a big part of this community health needs assessment. And then eventually, at the end of all of this, whenever we have to do our projects, we'll actually be using this data and just basically analyzing it and kind of breaking it down further to do a capstone project.
Yeah, so that's incredible, the access to the data, right, Abbott? You're going to have, by the time this is over, you'll have hundreds or thousands of responses to this, and that data, you're going to use that as well.
Yes, definitely. And we hope to get as many responses as possible to be able to accurately see the community for what it is. And I'd like to say, too, on top of this, we're so grateful for the health department. With our project, you can learn about it through books, but until you actually go out and meet the people, you don't quite, it's very important overall. And I don't think that we could do it without the people, the community members.
Yeah, getting out there.
Yeah. And, it's a win-win. Like, I know they're appreciative to the health department. The health department is appreciative to them and the school of public health in general, because let me tell you, it really helps us extend our workforce and give them an opportunity. It's just been so great having them in our community. Yeah. All
right, we'll take a quick break. We'll come back with Dr. Brian Huggins, Health Officer, Monongalia County Health Department. And we've got a couple of bachelor students, WVU School of Public Health, Melissa Spohn and Abbott Long. We're talking about the Community Health Needs Assessment. And we'll continue the conversation on WAJR after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday, our monthly visit with the Monongalia County Health Department. Dr. Brian Huggins, Health Officer, is with us, and we've got a couple of bachelor students from the WVU School of Public Health, Melissa Spohn and Abbott Long. They're helping with the Community Health Needs Assessment. And Dr. Huggins, we talked earlier about anybody can access this, right? You go to the Mon County Health Department webpage. Mm-hmm. It's out there on social media as well.
Yep. Today's going to be our launch day, so it might not be up right this second.
Okay.
But it's going to be up by the end of the day. We're going to run this at least until the end of October. We may run it into November. We just, I think over the weekend was our first time we were on the Jumbotron at the WVU football game. So they've been nice enough to the athletics team department to put up the QR code during the WVU football game. So anybody out there that's going to be going to the games, we really appreciate you taking a moment to do that while you're sitting there waiting, I don't know, halftime maybe.
Yeah. Or just take the QR code home with you and then do it when you've got 5 minutes.
Exactly.
At the end of the evening or whatever.
Yep.
Give us the difference between the secondary data and the primary data.
Oh, yeah. Absolutely. So secondary data and primary data. Primary data is data you collect. Secondary data is data somebody else collected that you're going to use. Mm-hmm. So when we talk about the Youth Risk Behavior Survey, when we talk about the census is the perfect example. They come around every 10 years. They ask you a lot of information about your house. It's supposed to be mandatory. That data is publicly available. People can use it. So that's a perfect example of like secondary data we use to understand like what is the ages, how many kids do we have under 18 in our county, are the school students included? And a lot of people don't realize that they include the school students in the dorms in that census data for Monongalia County. So they are a part of our community and affect how we get money from the government. Our primary data is going to be the survey. Mm-hmm. So the survey is really the biggest primary data. And then the hospitals, we partner. That's one thing I forgot to mention is our partnerships. We partner with the hospitals on this. And we also partner with a lot of our other partners. So we have a quick response team, our substance use disorder folks. We have a lot of partners in that we work with. And then we obviously work with the school of public health. So you might be getting this through emails from our partners, places like that as well.
Okay, very good. All right. Each of the students here, I'd like to ask you what you gleaned. You went out to the fair and talked to people and had them fill out the survey. What were some interesting things you found out about someone in particular, or was there some sort of consensus that you noticed?
Yeah, so the first people that I actually talked to were the vendors, because I was there on the first day and it wasn't super busy that day, so we decided that that'd be a perfect time to go and speak to who had tables set up. And I just think it was really interesting that everyone had different but similar backstory. For the most part, a lot of like West Virginia natives, and a lot of people just felt that their voices were never really heard on this, and they were, like I said, kind of surprised that we actually cared about what they wanted to say. And that was one of like the main things that kind of like blew my mind a little bit. But I guess it's fair because they'll ask you to do a study and it's on something that isn't really relevant to you, and they just want like your opinion on, where like this, it's in the community, it's going to be integrated. And I think us explaining that to people, they realized that maybe this was a little bit different than a survey that they'd been asked to take before.
Okay, very interesting. Abbott?
I totally agree with that. A lot of people really value that they were being heard, and once they realized that the survey wasn't just for something random, that it was actually for them, and that their voice mattered. And a lot of times I got the feeling that people didn't feel as left behind almost after having these conversations, after them being able to take the survey. But yeah, it was just a really positive overall experience.
Very good. We got about 1 minute left.
Yeah.
What would you like to say about getting involved in this?
Yeah, we really want everyone to help us, like they said. And the thing that I think they learned as well, because both of you are not West Virginia residents, and the thing I'm so proud about my state is people are so friendly here. Like really, when you engage people in conversation, and that this survey isn't like a lot of people, they think public health, they go back to COVID, right? That's not what this is about. This is about asking questions like, have you had trouble paying your rent? Have you had trouble getting food on the table? Do you want to not get hit by a car when you're walking along the side of the street or riding a bike, right? Those are the kinds of things that we really want to get from this study. It's not about infectious disease and vaccines. This is about how can we help everybody in Monongalia County just live a healthier life.
Yeah. All right. That's very well said. Nice job. Sum it up there. We appreciate it.
Yeah.
Dr. Brian Huggins, Health Officer, Monongalia County Health Department. And again, if you want to get involved in the Community Health Needs Assessment, you can go to that organization's webpage here anytime during the month of October. It's going to be up there. And you may run into one of these young ladies at an event, too, because they're going to be out surveying. Good job. We appreciate it. Thanks for your time this morning. Thanks for coming in.
Yeah, thanks for having us.
All right. That is Mon Health Talk for this Monday. Thanks for listening here on WAJR.